And now on the line is John Saunders, the Director of Shine, and I'm talking to John today in his capacity as Chairman of the Mental Health Commission. John, welcome to the programme.
Thank you very much.
John, I saw the report on RT television today about the meeting of the Oireachtas Committee on Mental Health that met this morning to talk about mental health services and the COVID situation. Your CEO of the Mental Health Commission had some strong things to say at it. For the benefit of the people listening to this interview today who haven't seen that RT report or other news about mental health services in Ireland today, can you tell us what you in the Mental Health Commission said at that Oireachtas Committee meeting this morning?
Thank you, Darren. I think it's important to understand that the Oireachtas committee that was meeting today was primarily interested in how mental health services were affected by COVID-19 and the last 3 months. And I suppose in summary, what happened is that the acute mental health units, which are regulated by the Commission, were as much affected as everyone else in the health service by COVID. All of the units had to take the necessary precautions to protect both their staff and their patients. And at some point in March, the Department of Health asked the Mental Health Commission to just do checks on the services to ensure that the COVID-19 response was being planned across the entire service. And that's what the Commission has done. So it looked at the risks for infection in all of the units and reported back to the HSE and to the Department of Health. And if they found any specific problems, and there were some, they escalated those problems to the HSE and asked them to be dealt with. So, for example, in the early parts of March, there would have been some concerns that some units didn't have enough personal protective equipment, for example, and that there was delays in the process of testing people who were suspected or high risk of COVID-19 infection. So when those issues were brought to the attention of the HSE, they were able to respond and deal with them. So that was the primary function of the Commission during that period. I think the other important thing to say about today's meeting was that the Commission was very clear that we were still charged with ensuring people's human rights are protected. And in that respect, we continue to make sure that the mental health tribunals were able to function. These are the tribunals that oversee a person's detention, involuntary detention, and make sure that they have an opportunity to have that decision looked at or examined. So all of those tribunals continued on despite COVID-19 and despite all of the problems around access and so on to the various services. The government, in its wisdom, along with lots of other decisions, changed the legislation to allow tribunals to be completed in a much easier way during COVID, and we were at points or at pains to make sure that, notwithstanding that emergency legislation, we're still able to protect people's human rights, and I think we've done that quite successfully.
There was talk today as well, I believe, wasn't there, at the Oireachtas Committee about mental health services in general. Your CEO, I believe, said that the mental health services in Ireland are not fit for purpose. You concur with that?
What we were saying is that in our reports, and he was referring particularly to the annual report for last year, which was released this time last week. Our reports for the last 4 or 5 years appear to do show a consistent pattern where there's a series of issues that appear to be unresolved. For example, basic hygiene and basic cleanliness and tidiness is an issue in many units. The inspectors found when they visited that there was a lot of dirty units, dirty furniture, unrepaired furniture, and so on and so forth. Privacy was an issue in terms of people not having adequate privacy to live in. There were certainly issues around staff shortages in some places and whether staff were appropriately trained. And other issues that came up were the amount of restrictive practices were used to control people's behaviour. And that again was stressed this morning at the Oireachtas Commission, that using any restrictive practice of itself is not therapeutic. It may help to control the situation, but it's not therapeutic, and certainly should not be an action of first resort. So there are lots of issues that I suppose have been coming up year on year, and the point that was being made was that we really do need to grab a hold of our mental health services and do some radical alteration to make sure that they are fit for purpose.
Okay, do the staff working in psychiatric hospitals and mental health centres have any excuse, John, not to be able to comply with all of the procedures as regards the delivery of services?
Well, it's not about excuses. We have, first of all, I have to say we have a cohort of staff working in mental health services who are very highly trained specialist staff, and our staff who are genuinely interested at a human level in making sure they provide the right type of care. But if you don't have staff in place, that type of care can't be given. If you have staff who don't appear to have the appropriate training, it's very difficult for them to deliver the type of service that they want to do. If you have staff who are maybe agency staff who come in to do a piece of work for a short period of time and then go again, it's hard for them to fit into a comprehensive team and provide that type of service. So it's not about a personal motivation or a person's excuse. It's about a person's being able to work as a fully functioning member of a team, and that comes down to organisation and structures and how a service is built around the patient and the client.
Okay, I have an interest in some complementary therapies, John, because one of them in particular, Reiki, has had a huge positive effect on me and still does. And I know that mental health organisations generally say or believe that there should be a range of complementary therapies available for users of mental health services. But John, in Ireland, we are a long way from seeing this happen, aren't we?
Certainly in Ireland, the model of service that we see on the ground is primarily what's called a medical psychiatric model, and it's dominated by the profession of psychiatry, which is obviously part of medicine, and it's strongly influenced by nursing practices. We do have other disciplines such as psychology, social work, occupational therapy, and so on, but by and large, some of these, many of those posts are not filled. And this is the problem behind the community mental health teams, that they don't have the full complement of staff. I know individuals use complementary medicines. All sorts of people for all sorts of ailments will use complementary medicines. By and large, and hopefully they're all safe. I don't know enough about them myself directly to comment on that. But people do use things like Reiki, like mindfulness, like relaxation, like yoga, and so on, to help them to deal with not only the physical but also the mental anxieties and worries that they have. And I think that's all pretty good, and I know that many services may well introduce some of these as options for people, but they're certainly not part of the core service. I think that's because we still have a very medicalized service which insists that the only way of approaching severe mental illness is to deal with it through a medical psychiatric model. The Vision for Change policy and the most recent version of that, sharing the vision, is very clear that it's not just about psychiatry, it's about a whole range of disciplines providing a multidisciplinary approach.
And as you're saying there, we have a new 10-year strategy we launched only a few weeks ago. Like, how confident or realistic is it to hope that over the next short few years we're going to see an increase in funding, or we're going to actually see this strategy implemented well?
Well, I suppose the positive is that the strategy is reinforcing much of what was already in Vision for Change. As you have identified, the big ask, the big issue is, have we the resources to do this? And I would say, well, first of all, it's not costed, so we don't know at the moment what resource we're talking about. But I would say that there needs to be a political ownership of this, and we need, at a political level, I talk about government and departmental level, need to realise that if we're going to progress mental health services to the type of services that we all want and all talk about, we're going to have to invest money. There's no question around that. It cannot be done for nothing or with existing resources. So we certainly can restructure existing resources, but we do need additional money to make sure we have the right people in the right place to be able to deliver services at the right time. And that is according to the policy, which is a community-based, home-based team service that will support people in their own communities and prevent or minimise people having to go into acute units.
It'd be great if there were 24/7 services available, like throughout the week, wouldn't there? Like, because a lot of people don't. A lot of people, if they're having, if they're unwell, it happens on the weekend, and most of the staff generally aren't working.
Well, this is what we need to be very careful about. This, we actually have about 63 acute mental health units. They all operate 7 days a week, 24 hours a day. Now, they may have less staff at weekends, but they're all available. And what we have to do is work out a very clear system that allows people, as you say, to access them on a Thursday night or a Friday night or a Sunday morning when they may need to have some response. Mental health, like anything else, is not a 9 to 5 issue. It's a 24/7 issue. So the resources are there. We just need to utilize them better and plan so that they can be available to people.
Because what happens at the moment is people have to go to, if they want to, on a service on the weekend or during the early hours of the morning, they have to go to the emergency department, don't they?
Correct. The default, I suppose, in Irish hospitals is that everybody goes to accident and emergency, except for planned surgery, obviously, and planned admissions. But everyone goes there, and then you are triaged, if you like, and people decide what needs to happen. But in mental health, it's much more complicated because of the behavioural issues, and I think people do need some sort of fast track or shortcut, for want of a better word, into the mental health service, which avoids that difficult confrontation or situation in accident emergency units.
I interviewed outgoing Minister for Mental Health, Jim Daly, a few weeks ago, and one thing we're talking about is the new service they have based in Castlereagh for young people and adolescents. Do you know much about that? Do you want to say anything about that?
I know little. I know that it is part of the CAMS service, the Child and Adolescent Mental Health Service, and it's a way of remotely through video conferencing or other types of remote systems, having patients, clients talk to a psychiatrist and get some direction. I think there's limited value in those systems. I think mental health ultimately is about people talking directly to each other and building up that social and interpersonal relationship, which helps people to deal with the issue that they have. This is what happens every day in services between doctors, social workers, nurses, psychologists, and so on, and clients. The digital platforms are useful, but they must, in my opinion, be an adjunct or a complementary service to the face-to-face service, and they should not and cannot replace the face-to-face services. And I think my fear with digital services is that people can see them as an easy replacement for staff that they cannot get or for whatever reason are not available to deal with issues. So I think it's certainly valuable, but not the solution to everything.
Okay, John, is there anything else you want to tell me and our listeners about the work of the Mental Health Commission at the moment, leading us into next year and the publication of your annual report for 2020?
Yeah, just to, I suppose, assure people that through COVID, it's been a really difficult time for everybody, but not least for those families and those people who are directly affected by very severe mental health. That the Mental Health Commission has been working really hard to make sure that COVID hasn't adversely affected people, and hopefully we will be able to get beyond this situation now and get back to some sort of ordinary service, if that's the right word. And I think the Commission is committed to continuing its work and to make sure that we try and develop and support and encourage the best possible service we can for people with mental health problems in Ireland.